I would like to move on and introduce our next presenter, Deyyan Jaffa from Conviction Group. Deyyan, I'm pleased that you're here and really happy that we've been able to partner in a great project over the last couple of years. And I'll let you introduce yourself, and then you can speak to us.
Fantastic. Thanks, Neil. And thank you for organising it and for inviting us, and for all those that have been involved. So as Neil said, my name is Deyyan. I've also got Cassidy with me as well, and we're both going to be representing Conviction Group and talking about a project that we've been working on. Let me just do a quick screen share. Hopefully this works. Is that simply... Can everyone see that? The PowerPoint?
Yes.
Perfect. All right, fantastic. Okay, so Cassidy and Cassidy, you're also on the line. We can say a quick hello too.
Yeah, thanks, DJ. Hi, I'm Cassidy. I'm the research coordinator at Conviction Group, and DJ will be speaking first, and I'll come in a little later with an update on our current project.
Fantastic. We also had Marco Capobianco, one of the CEOs the CEO of Conviction Group, but unfortunately couldn't make any sense. Apologies. We're all very excited for this, so let's jump straight into it. So we wanted to start off by just explaining and just describing who Conviction Group is. So Conviction Group was an organization that was co-founded by two individuals, Marco Capobianco and Chris Lee, back in 2014. And really the idea of our organization is to work towards building a generation of empowered young Australians that are really capable of taking responsibility for their personal health. So that was our key vision that we wanted to work towards. And the way we wanted to do this is actually a little bit aligned with what Toby, you were talking about in your presentation, which was this idea of, improving health outcomes, or investigating whether health outcomes are associated with individual choices. And we really wanted to try and equip individuals to make good decisions. And so that was our mission. We wanted to encourage young people to really reevaluate their perspectives on really key issues concerning their health, and more importantly as well, or equally importantly as well, equip them with the tools that would enhance their decision making. So this was our vision, this was our mission. The way we were going to try and achieve this was was three ways. The first one being our Young Men's Health Forum, which is our flagship forum. We now organise 3 of these forums every year for 3 different regions across Sydney. So Western Sydney, South Sydney and North Sydney. We usually bring about 20 different schools across that region, approximately about 240 to 300 students coming in, listening to speakers, and also undergoing workshops with Conviction Group facilitators. Then we also have our boys mentoring program. This is when a mentor goes into schools and runs, a certain number of weeks worth of content, depending on what the school prefers, on different topics relating to men's health. And then we also do school presentation workshops. So across all of our 3 programs, Conviction Group works with about just under 5,000 students a year, which is an incredible number, and we love what we do and what we're sort of working towards. And it, Marco and I, we were thinking a lot about all of these students that we're working with, and we're delivering these programs for them and trying to understand and trying to equip them with these tools for decision making. And we thought it's really important for us to really better understand the young people, especially the young men that we're working with. And through that came upon this opportunity to partner in a research partnership capacity with Western Sydney University. We had a mutual connection, and there so started our wonderful partnership that we've had, that Neil's brought up, has been for a couple of years now. You know, and in conversations with, you know, Neil and his team and Conviction Group and our team, you know, we came away with a lot of like key principles. And one of them was, we wanted to consider the young men that we were working with as really valued individuals, and wanted to understand, or let them communicate their experiences of what it is like to be a young man trying to navigate and manage their well-being. And the second principle that we really wanted to focus on was, we wanted to step away from what we feel were more traditional deficit style models that previous research may focus on. So this idea of like, what makes young men unwell? You know, we wanted to step away from that and try and look at things a little bit more holistically, and also try and understand what young men are trying to do well, or what they are doing well, or just what their experiences are. So once we realized we wanted this to better understand our young people and set up this partnership, we then underwent our project, which was to build out a young men's health report. And the objective of this was, as I said, to gain some understanding of, you know, young men's health perspectives and their experiences of what it looks like to be a young man who's managing their well-being. And first, it was important for us to really be equipped and knowledgeable ourselves of what the young men are experiencing. And so we did a pretty comprehensive literature review of 3 chosen topics that we picked, and they were mental well-being, masculinities, and healthy relationships. And these were the 3 topics that we focused on in our report as well. And then after equipping ourselves with some knowledge, we brainstormed and workshopped a lot between Neil's team and our team, and we built out this survey that we wanted to give and present at one of our forums. So we completed the data that we're going to show you now was from our Sydney North Forum last year. And we had a great turnout. We got responses from 204 males, all aged, you know, between 15 and 16. And Toby, that was another cool thing I realized. Your research was looking at people or children aged from 8 to 15. And now we've sort of like tacked onto that and brought on the 15 to 16-year-olds as well. So what I'm going to do now is present a little bit of the research that we sort of found. This is going to be a very quick snapshot just because of the time, given we really built out a comprehensive survey asking heaps of questions, but this is just going to be a little bit of what we found. So we asked the young males how important mental health is to them and how important physical health is to them. So 2 different questions, and you can see the graph up there as well. And what we sort of found when we were comparing the responses is that we can see that the young male are probably seeing physical health or rating it more important than mental health. And you can sort of see some of those in the graph there. And what was a bit of a relief is that, you know, only a very small percentage of young males thought that either aspect of health was not important. But what we hoped to soon understand, we didn't get to this in our survey this time around, is to really understand why there is a bit of a difference between importance placed on physical health and mental health. You can see that, you know, for those that think physical health is extremely important, there is an 11% difference between those compared to mental health. So really trying to, expand on that hopefully in future research, but this was a good finding for us to understand. The next one being about actions taken as a consequence of feeling upset, worried, or stressed. And these came about from 2 questions we asked. So we first asked them, in the past 30 days, have you felt upset, worried, or stressed? And depending on whether they said yes or no, we then asked them the question of, if they said yes, what did you do out of the following to, help alleviate those feelings? Or if you haven't felt that way, what would you have done? And you can see the graph there with the results. We see a similar pattern of responding, regardless of whether, you know, the males had selected yes, they had felt upset over the past 30 days, or no, they hadn't. The only exception to that being is that those who did report feeling upset, worried, stressed, or down, to those of the black bars, they were more likely to keep it to themselves. You could see that difference between almost 11.5% and then 16.5% as well. So the most common responses generally being that they would talk to a friend. And what we were quite interested in is seeing that, you know, it is quite normal for people to experience these emotions of upset, worried, stressed, or down, at least in a month's period. So we were a little bit concerned that 23% of respondents were saying that they haven't felt that way, but it also could be, you know, a lack of emotional awareness or not wanting to admit. So there's different layers to this, but again, it brought about some interesting findings for us. The next thing was to look at facilitators of help-seeking behaviours. So this came about, again, from two questions that we asked. The first one being, have you ever sought help from a mental health professional? And if yes, what made it easier to seek help from that professional? And if no, if they ever did require that help, what would make it easier for them to do so? It was quite interesting for us. Young males said that, you know, across both who had sought help and those who hadn't, that really needing to talk to someone was the top answer. So knowing that they needed to talk to someone was a big facilitator for them actually reaching out to a professional. And so, you know, there might be some evidence or some argument put forth that there's a level of self-awareness that's, you know, being required for them to seek help. And that might actually come in internally or externally. The externally being, you know, a referral from another service or, you know, someone encouraging them to go, which from the graph as well, you can sort of see, I'm not sure if this comes up, these ones here, you can see that, you know, they're quite higher too as well. Quite interesting, anonymity was ranked quite low for people who hadn't sought help compared to those who had. And we think that maybe it was, you know, this fear of, you know, fear of being known that's acting as a barrier to seek help. But once they realize they needed help, it might not be that, important after all. We also looked at healthy relationships and asked our young males who they would go to on advice for relationships, and friends were the most common people that young males would look to. This parallels a lot of earlier findings that we sort of found, that they would like to talk to friends about their feelings. Interestingly, teachers did not appear to be a very trusted source of advice about, you know, talking to about relationships, but even extending to, you know, feelings or seeking help from earlier questions we found. And we also asked them about what characteristics they think is of being a healthy male. And, you know, very positively, we found that young males most commonly rated, you know, happy as their first choice, followed by respectful and strong. So these are the red bars that you can see. And so this sort of indicates that, you know, there is a value being put on young males being healthy that doesn't relate to them being independent or stoic or control. So breaking down that, maybe that hegemonic masculinity ideal that earlier research or sort of stigmatized as well. So this really was a very quick snapshot of our research, but it was great. You know, the mental well-being attitudes and practices of the young men that we surveyed, it really did give us some flavor or some idea that maybe we are moving towards a new direction or in some sort of new territory that's suggesting some sort of evidence of a shift in young males, you know, that there is an alternative discourse to that hegemonic masculinity in relation to talking about feelings. We also looked at their behaviors online and also their help-seeking behaviors, which was quite exciting and something that, you know, we absolutely were so excited to find and love talking about. And again, this was just a very sort of snapshot of what we found and what we wanted to point out, but it really has set up very nicely for what we're wanting to do next year or this year and next year. And I'll let Cassidy talk about that. Cass.
Just need to unmute Cass. Oh, are you trying to share screen?
No, can everyone hear me now?
Yep.
Okay, perfect. Sorry about that. Thanks, DJ. So I'm Cassidy. I'm the current research coordinator at Conviction Group. And we're currently working on one large project with Western Sydney Uni this year. And this is expanding upon the research project that Deyyan just talked about. So we're now conducting a 2020 Young Men's Health Report. And basically with this, we want to expand on the findings in both the 2019 report and the survey, and provide an update on the literature that's been released since the last report that Deyyan just spoke about. So we currently have a Western Sydney Uni student, Simon, who's working with us to complete the literature review and help us with the Young Men's Health Report. And we're mainly wanting to look in the domains of mental wellbeing, masculinity, and healthy relationships. And we particularly want to expand our knowledge and try and understand further the key findings that we found in our 2019 report. So one example is that what Deyyan highlighted was that the primary factor for help seeking for young males was just simply knowing that they needed to speak to someone. And this is something we wanted to understand more, and something that we're trying to look at in our literature review to see if this is something that other people are finding, whether this is something cross-culturally as well, that this demographic really has struggled with their mental health literacy and self-awareness of knowing when they need to talk to someone and when it's appropriate to seek help. And to further expand our knowledge, we have reviewed the 2019 survey and added some additional questions and modified some of the questions from the 2019 survey. So this makes up the second component of our project with WSU. So what this is looking to provide is further understanding on the 2019 report. So particularly in, well, what makes, someone know they need to talk to someone? How can we help with mental health literacy? How can we help with self-awareness? And things like that. And we particularly wanted to ask some questions in relation to masculinity and healthy relationships a little further, as this is something that was briefly touched on in the 2019 survey, but we wanted to build this out a little bit more. And we particularly want to capture things surrounding body image and appearance, as we noticed from conducting our literature review that this was becoming a trending topic in the literature in the young male space. Given the current COVID-19 situation, we had to cancel 2 of our forums this year. The third forum is still pending. So we would normally have access to around 700 to 900 year 10 male.
Cass, you've managed to mute yourself again. But we probably do need to wrap up at this point. So thanks so much for DJ and Cassidy presenting that information. I'd like to have time for one question, if there's something coming from the audience. I can't see anything.
I guess I'll ask a question. I don't know if I'm on here.
Is that you, Bob?
Hi, Neil.
Hey.
Just a question. I just joined 3 minutes ago and was listening to this young woman talk about a variety of teenage kind of assessments. And I guess the question is to the group, whoever it is, have you guys implemented things like peer counseling and teen groups and teen things that like outdoor events for teens and young people and relationship workshops? I'll stop there, Neil.
Thanks, Bob.
Yo.
Thank you for your question. So we're largely focused on providing educational tools for young people. A lot of those topics that you brought up about healthy relationships are really covered across our forums, our presentations, and our mentoring programs, where we bring either expert speakers or mentors that run facilitated workshops or speaker sessions to try and improve students' knowledge and give them some sort of skills or tools that then they can move into their environments and then make appropriate decisions. So not so much getting them outdoors and you know, in that sort of like active space, but really providing them with a key or critical knowledge base that allows them to make good, healthy decisions.
Great. Thanks, DJ. I'll just highlight a comment from Anthony Brown in the chat box. Such amazing work. It really challenges that dangerous stereotype that men don't talk. And I think that's one of the most exciting things that I've found about the research myself. So, thanks again, DJ and Cassidy. That's really a great snapshot that you've provided for us. And hopefully there might be some other questions pop up at the end of the session. Everyone can dip in on. At this point,
we'll just add that the report, it's going to be uploaded very soon, a full comprehensive report, including all the questions that we've asked and analyses of them.
Fantastic. That's good to hear.